Hi, Dr. Taylor here again, and we're going to go over sleeping issues and insomnia. So what we're going to do today is we're going to go over a general protocol that we use in our office for people with sleeping issues and insomnia that does really well for most of our patients. Now obviously there's going to be deeper issues that might need further testing for, more exploration to figure out exactly what's causing it. But this will give you a kind of a service level knowledge so that you can hopefully help yourself at home. So things that won't be covered in this are things like sleep apnea, obviously mechanical issues, so losing weight and other things can help with that, CPAP machine, all that kind of thing. Metal imbalances can definitely affect sleep, specifically with insomnia, just what it does with the brain. So maybe taking somebody through a detox protocol, maybe doing some further testing to find out exactly what metals are and how we want to pull those out. Things like magnesium issues. So I mean, if you have sleeping issues, magnesium is typically a place you might start supplementing with to see if that helps you with sleep. Helps a lot of people with sleep. Something else that wouldn't be covered in this would be a GAD or GAD1 genetic SNP, single nucleotide polymorphism. What that gene does specifically is it converts glutamate into GABA. GABA is a neurotransmitter that helps with sleep. So if you don't have or you don't make GABA very well, you can have low GABA, which could definitely cause, like say, insomnia or sleeping issues. The easiest way to think about this is the bucket analogy. And this is developed by Ben Lynch, who does great work with genetics. Basically, as far as GABA, say you're not producing enough. So we have this bucket and you're on the lower end and you're having a lot of GABA issues. So what you do is you supplement somebody with specific GABA supplements, try to fill that thing back up to normal. So even with the genetic issues, that's more of something you might have to take long term because you can't fix the genetics, but you can work around them. So like I say, you take enough stuff to get it back to normal, and then because you'll run out of GABA faster because you don't convert very well, when its stores start to get lower, you can supplement again. So maybe that's taking a GABA supplement once every couple of weeks, once a month, whatever that might be, once you get your stores built back up to a normal level. Also things like parasites. Parasites are a big hidden issue in relation to sleep and insomnia. So things interesting about parasites is you can have positional parasites. So you can test somebody with applied kinesiology or just muscle testing. They won't show up standing up, they won't show up sitting down, but they'll show lying up, or they'll show up lying down. So you have to test for these positional parasites, which can definitely affect issues like this. So with the general protocol, we're going to go over basically, things that'll help falling asleep, things that'll help when you're waking up at specific times of night, and things that'll help when you wake up really tired. So you see from the chart here, if you're having trouble falling asleep, that's typically a gallbladder issue. And when we're looking at this, we're looking at more as traditional Chinese meridians and issues through there. So we're looking at gallbladder. Like say, when we have patients that have these issues, we support them specifically, and they do fantastic with these issues. Now, there might be some underlying stuff, like say, we have to do further testing for or dig deeper on, but this helps quite a bit. So gallbladder supplements, something we might use in our office would be something like gallbladder ND, which is nanized delivery. It's a probiotically fermented live source vitamin that works super well. It's a liquid, absorbs right away when you take it. So trouble staying asleep. So you see the chart down here goes over different time periods where somebody might wake up at night. So if you're waking up between 11 p.m. and 1 a.m., that's also a gallbladder issue. So if you want to look at it, like say nutritionally, organ-wise, metabolically, that's what we're looking at on this side of the chart. Over here, we're looking at more emotional issues that'll feed into why people have sleeping issues or insomnia. So if you're waking up from 11 p.m. to 1 a.m., you're looking at more emotional disappointment. So at that point, trying to practice more self-acceptance and techniques like that will help with the sleep pattern. If you wake up between 1 a.m. and 3 a.m., we're looking at more liver. So supporting the liver, you might do something with B vitamins. Max BND is great, nanized delivery as well. Liver ND. There's lots of different supplements that'll work for the exact same organ. This is also why we do the muscle testing in the office, so that we can see which specific supplement is going to work best for the person. Because you might come in, liver might be the issue. We'll give you Max BND, but that might not be what's going to help the issue specifically, so we can muscle test. Maybe it's liver ND, maybe it's Medcaps CPO. Maybe, that's what we can do in the office as far as testing, to be more specific to make sure we're really going to help the issue. Like say if you're waking up between 1 a.m. and 3 a.m., that's more related to anger. So trying to make peace with any kind of issues that you have going on in your life currently. 3 a.m. to 5 a.m., you're looking more lung. So same idea, supporting the lung, maybe with some Pneumoven or other supplements that we have, like say testing specifically as far as that's related. Emotionally, we're looking at sadness, so taking deep breaths, trying to resolve issues. That will help with that aspect between the 3 and 5 a.m. And if you're waking up between 5 and 7 a.m., I'd say first of all, you don't have kids, but that's a different issue. So if you're waking up between 5 and 7 a.m., that's the issue that you're looking at. You're looking at more large intestine. So could that be things like leaky gut? Yeah, that could be a lot of different things in through the intestinal tract. Maybe probiotics, maybe fixing the gut, or what's needed for that specifically. Or if you're looking at the emotional side, you're looking at emotional blocks. So release pent-up feelings will help people get to sleep better if that's the issue they're having. So could you have issue, maybe you wake up at between 11 p.m. and 1 a.m. and 3 a.m. and 5 a.m. Yeah, you could have multiple issues. So maybe you need to support the gallbladder and the lung. Or maybe you wake up a lot during that. Maybe you need to support all of them. But these are things, hopefully, that you can implement it at home. That'll help you a lot. Groggy says difficulty getting out of bed in the morning. Typically there you're looking at adrenal issues. So Adrenovan, adaptogens, OptiAdrenal, a lot of different products that work really well for adrenal support that we can test you for specifically, but that will help with those issues that you have in the morning. So like I say, general protocol that we use for people with sleeping issues that works really, really well, and you could possibly implement at home for yourself. Like say, there could be some more deep-seated issues that maybe we need to do more testing, or we need to be more specific on what you need to take to get you to feel better, to get you to sleep, all that kind of stuff. So like I say, I hope this helps and it's something that you can implement at home. But if you need further guidance with this, we're always available. My name is Dr. Taylor, and I hope that helps.